Welcome everyone to the Reinhardt's Rundown. Today we're going to review some clinical pearls about topical dosage forms, specifically as they relate to corticosteroids, which is one of the most common medication classes that we see prescribed. We use topical corticosteroids for tons of things like rashes, itching, irritation from bug bites, poison ivy, eczema, psoriasis, lots of dermatological conditions. The most common topical corticosteroid is, of course, hydrocortisone, which comes as 0.5% and 1% over the counter, but there are about 15 different topical corticosteroids available by prescription. They vary greatly in strength, potency, and dosage form, so today we're determining whether the dosage form actually matters. To be short and sweet, yes, it definitely does. It matters very much. The steroid vehicle, or the dosage form, influences the actual strength of the medication. In general, this is the potency breakdown, with ointments being the most potent, but creams and lotions coming next. Ointments have the most oil of all the skin products, and they stay on your skin longer, meaning the contact time of the steroid drug is longer. Creams have a higher water content than ointments, so they are absorbed a bit easier and have better spreadability. This is great if you have a larger area, for example, to cover. Lotions have more water and are thinner consistency, but still more oil-based than solutions. Solutions often contain alcohol, as do gels, and finally sprays have the lowest potency of all. Think about how your skin feels 5 minutes after applying Vaseline versus something like aloe vera. The petrolatum base increases the potency and stays on the skin much longer than the gel, which dries quickly. Location and reason for use also matters. Ointments are better for skin protection, holding in moisture, and treating dry, patchy areas like psoriasis. On the other hand, lotions, gels, or foams are better for hairy skin or oily skin where we need that drying effect. An example of this would be an acne treatment. Thanks for watching today. That's the Reinhardt's Rundown.